The question of whether AI should be formally integrated into healthcare systems, rather than existing as an external tool individuals use independently, requires careful consideration of both potential benefits and significant challenges. Integration could bring standardization and quality control, but also risks and implementation obstacles. The potential benefits of integration are substantial. Official healthcare system adoption of AI tools would bring them under institutional quality control processes. Instead of individuals using random AI chatbots of unknown reliability, patients would access verified AI systems that healthcare organizations have evaluated and endorsed. This institutional vetting could improve average quality and reduce exposure to unreliable or dangerous AI tools. Consistency in health education and guidance is another advantage. When AI is integrated into healthcare systems, all patients receive information based on the same knowledge base and clinical guidelines that inform their doctor's care. This consistency supports coordinated care and reduces conflicting information that can confuse patients and undermine treatment adherence. Patients and providers would be working from shared understanding rather than patients arriving with AI-generated information that contradicts their provider's advice. Triage scaling could improve access and efficiency. Healthcare systems struggle to handle patient volume, especially for questions that don't require full physician expertise. AI-powered triage systems could handle initial assessment, gathering symptom information and routing patients to appropriate levels of care, emergency services for urgent situations, urgent care for next-day needs, scheduled appointments for routine concerns, or self-care guidance for minor issues. This could reduce wait times and ensure provider time is spent on cases requiring human expertise. Patient education at scale is practically impossible with current staffing models. Providers don't have time to thoroughly educate every patient about their conditions, medications, lifestyle modifications, and warning signs requiring follow-up. AI could provide personalized, comprehensive health education that supplements brief provider explanations, potentially improving outcomes through better patient understanding and self-management. However, integration challenges are formidable and require serious attention. Standards for quality, accuracy, and safety must be established before healthcare systems can responsibly deploy AI tools. What level of accuracy is acceptable? How should AI handle uncertainty? What safety mechanisms prevent dangerous errors? These questions don't have obvious answers and require multi-stakeholder consensus processes involving clinicians, patients, ethicists, and technologists. Interoperability with existing health IT systems is technically complex. Healthcare systems use diverse electronic health records, scheduling systems, lab systems, and communication tools. AI integration requires connection to these systems to access patient information and document interactions. Achieving this interoperability without creating security vulnerabilities or workflow disruptions is a major technical and organizational challenge. Clinician training and change management cannot be overlooked. Healthcare providers need to understand AI capabilities and limitations, learn to work alongside AI-powered tools, and adjust workflows to incorporate AI appropriately. Resistance from clinicians who feel threatened by technology, don't trust AI reliability, or resent changes to familiar workflows can undermine integration efforts. Successful adoption requires substantial investment in training and organizational change management. Liability and medical legal concerns become more complex with integration. If a healthcare system provides AI tools that give dangerous advice, is the institution liable? What about the AI vendor? The individual clinicians involved? Clear liability frameworks don't exist for these scenarios, creating risk aversion that may slow adoption even when AI could be beneficial. Insurance and legal systems need to evolve alongside technological capabilities. Phased approaches offer a practical path forward that balances innovation with prudence. Starting with non-critical tasks minimizes risk while building experience and confidence. AI-powered appointment scheduling, patient reminders, general health education about common conditions, and pre-visit symptom documentation are relatively low-risk applications that could demonstrate value and build organizational capacity for broader deployment. Clinical decision support with constrained scope could follow initial deployment. AI might assist with differential diagnosis suggestions, drug interaction checking, or guideline adherence reminders, but always with human clinician review and final decision-making. These constrained applications provide decision support rather than autonomous decision-making, maintaining human oversight while leveraging AI's data processing capabilities. Audit trails and quality monitoring must be built into integrated AI systems from the beginning. Every AI interaction that informs clinical care should be logged and reviewable. Regular audits should evaluate whether AI recommendations are appropriate, identify patterns of errors or biases, and provide feedback for system improvement. This ongoing quality assurance is essential for patient safety and for maintaining clinician trust in AI tools. Clinician sign-off requirements for any consequential AI recommendations ensure human accountability remains clear. AI can gather information, perform calculations, and suggest possibilities, but licensed healthcare providers should make final decisions about diagnosis, treatment, and triage. This maintains the traditional accountability structure while allowing AI to augment human capabilities. Patient consent and transparency about AI involvement should be standard practice. Patients deserve to know when AI is being used in their care, what role it plays, what its limitations are, and what alternatives exist. Integration shouldn't mean AI becomes an invisible, unquestioned part of care delivery. Transparent communication about AI use respects patient autonomy and enables informed participation in care decisions. Pilot programs with rigorous evaluation should precede widespread adoption. Healthcare organizations should implement AI tools in limited settings with careful measurement of impacts on quality, safety, efficiency, patient satisfaction, and health outcomes. These evaluations should inform decisions about broader deployment and identify necessary modifications before scaling. Learning from controlled pilots reduces risks of widespread implementation of problematic systems. The fundamental question is not whether to integrate AI, but how to do so responsibly. AI capabilities will continue improving, and healthcare systems will increasingly adopt these tools whether or not there's deliberate coordination and standard setting. The choices between reactive, fragmented adoption driven by vendor marketing and provider ad hoc decisions, or proactive, coordinated integration guided by patient safety principles, equity considerations, and evidence about what actually improves care. The latter approach requires substantial effort, but is necessary for AI to enhance rather than disrupt healthcare delivery.